I'm Dr. Yeprem, and I'm a chest disease specialist. And I thank for the invitation of the organization committee and company Specta, very kind. And I thank you very much again. Actually, I've been doing ozone therapy since 25 years. And I'm a member of World Ozone Federation and EuroCOP, European Ozone Corporation. And I'm the president of Medical Ozone Society in Turkey. And I've been teaching in behalf of Ministry of Health in Turkey. And I've been taught, I guess, 3,000 doctors since many years. Well, in aesthetics, ozone is in a different place. You know, I'm also doing fillers, PRP, exosome, and so on. But ozone is in a different place. Aging starts from the cell, actually. If our cell is old, then it comes through the skin, and we become older by time. And if we start to regenerate our cell, or if we start to protect our cell in the beginning of the mid-ages, then we age slowly, and our quality of life increases in time. So, who does know ozone therapy? I have been to Morocco once last year, and we had a very nice meeting also in Ujda University. But I want to know who knows ozone therapy in this room. 2, 3, 5, let's say. Yes, not so much. Then I will introduce you what is ozone and where we use. It is actually a bio-oxidative therapy, and it is a pure oxygen and ozone gas mixture. And it's been actually made up by the doctor just by the bedside of the patient. And you see here, it is a combination of ozone 0.5%, 99.95% oxygen, and it has a dosage 1 microgram per ml. And if the combination is 5% ozone and 95% oxygen, it's 100 micrograms per ml ozone. We are producing the medicine by the patient, actually. And the needs of the patient makes us choose the dosages of the ozone. And where do we use ozone? Actually, you know, inflammation is the hardest issue that we struggle as a doctor. You know, we have many chronic inflammatory diseases, COPD, rheumatoid arthritis, colitis, ankylosing spondylitis, so many of them. And this is the most important issue that we use in ozone therapy. And arterial circulatory disorders also, chronic fatigue syndrome and fibromyalgia, and tissue oxygenation and regeneration, viral infections and prevention for viral infections, supportive in cancer therapy, and you know, diabetes is the pandemic, a second pandemic, I think, because many of the patients has a hypoglycemia or insulin resistance or diabetes. So it's very important. We can do a prevention in diabetes, or we can treat diabetes, not only with ozone. Actually, we are also giving supportive nutrition and vitamins and so on. But ozone is very important because we can regenerate the pancreas by ozone therapy, and allergies and autoimmune diseases. And if we increase our energy, if we increase the oxygenation of the tissue and do the regeneration of the tissue, and if we regenerate the endothelium of the arteries and vessels, and if we regenerate the cartilage, then we are actually doing an anti-aging process to our patients with ozone therapy. And what are the applications forms of ozone therapy? Major autohemotherapy. It is the queen actually of the applications in ozone therapy. It's done by the blood. We are withdrawing 100 milliliters of blood from the patient's vein, and we are giving ozone oxygen gas mixture into the bottle, and then we are reinfusing it, and we are doing this 12-15 times to the patient according to the need of the patient, and we are actually stimulating the antioxidant system. Maybe you have heard glutathione system, superoxide dismutase and catalase are the most important antioxidants in our cells, and we are actually by ozone stimulating these antioxidant systems. And with this major autohemotherapy, the red blood cells releases oxygen to the peripheral tissue, and so we can increase the tissue oxygenation, and we can also increase the nitric oxide so that we are vasodilating the arteries and the capillaries, so that we can increase the circulatory movements in the peripheric arterial oxygenation. So, and also rectal insufflation is another application form. It acts as similar as major autohemotherapy. If we cannot do major autohemotherapy because it's an issue of chemotherapy, that patient has bad veins, or very obese patients, so we cannot reach to the vein, or maybe it's a baby, we cannot do major autohemotherapy. We can do alternative rectal insufflation. We just give the ozone oxygen gas mixture into the rectum. And another form is the minor autohemotherapy. We can use in allergies, acneas, and supportive in cancer. And we can do topical treatments in wounds, diabetic wounds, and burned extremities and so on. We do bagging and cupping for the wounds. We can do local treatments, intra-articular treatments, intramuscular treatments, subcutaneous treatments with ozone therapy, just giving the ozone directly into the article or muscle or joint, wherever we want. We can do vaginal insufflation if we have chronic candidiasis. We can also give ozone oxygen gas mixture, and it's incredible, very nice results. We can use ozonated water, and we can use ozonated creams. And this is we are getting ozone oxygen gas mixture from a medical ozone generator. And this is the latest generation of medical ozone devices, iMode. It's an intelligent medical ozone device named after. It's a touchmatic screen, and you can select the applications and the dosages you want. And for ozone production, we use an oxygen tank, and it's produced by the machine, and it's measured by photometer or an artificial intelligence software, and then we use it, and the part that we don't use goes to the catalyzer directly. The only place that we cannot get ozone is our lungs. inhale ozone because it is actually oxidative gas, and our lungs cannot deal with this oxidation. And here we are using a bottle here for ozone therapy. It's a vacuumed bottle. It has citrate in it, and we get the blood here and we give the ozone via the bacterial filter, and it's a microbubbling, and the bioviability is very much as our alveoli in our lungs. The bioavailability is much when the bubbles are very small. And here we have many indications: see ulcerative colitis, proctitis, fistulas, general activation for the old people and prevention for the infections, arterial circulatory disorders, diabetic patients, and complementary in oncology, chemotherapy and radiotherapy, before chemo and radiotherapy or after chemotherapy and radiotherapy. And we can also use for hepatitis B and C and varicella zoster and corona. During corona pandemics, we used the World Federation of Ozone Therapy declared that we can use ozone therapy for prevention and for treatment. And we treated many patients in the hospitals in Turkey. We had a study about 300 patients, and none of them went to the intensive care unit who got prevention of ozone therapy. And some of them who were in the intensive care unit, they did not die. They they were deported from the hospital as healing. And you know, diabetes is, as I said, is the second pandemics for me. There are so many patients, and we are using direct and indirect reactions of ozone therapy. The direct reaction is when the patient has a wound, we put the patient's leg into a bag, like a bath of ozone therapy for disinfecting and making the epithelialization of the wound. And you know, for anti-aging and in aesthetics, where do I use this? Maybe you think, but many patients has diabetes. Many patients has also chronic inflammatory diseases, and with ozone therapy we increase the quality of life of the patients and decrease the need of medication. So this is very good for the quality of life of the patient. And this is the indirect use. We do the disinfection of the wound, but for regulation of the system, we use the indirect reaction. Now I will explain actually the mechanism of action, so you can imagine it better. We give the ozone into the bottle, and in the plasma we have the antioxidant system, superoxide dismutase and catalase, and inside the cell we have the glutathione system. We give the ozone, it comes to the plasma, and it reacts with the double chain bond of the cell, and it goes inside as the glutathione, as ozone peroxide, and it stimulates the glutathione system. With this glutathione system, what do we do? In the cell, we activate our antioxidant system. This is very important in aging. You know, oxidation makes us aging. And we stimulate the antioxidant system of the cell. And if we do this as a protocol to a patient in years, then you can see that their skin changes, their hair becomes very nice, the energy is increased because ozone is increasing the ATP in the mitochondria. Mitochondria is our energy centrals, actually. It increases our energy. So if we increase the antioxidant system and immune modulation, you know, these are the inflammatory cytokines. We decrease the inflammatory cytokines and increase the anti-inflammatory cytokines, so we can control the inflammation in the body. Inflammation is everywhere in our vessels, in our arteries, in our joints, in our skin. So we can slow down the inflammation and increase the antioxidant system. Here we have occlusion in the arteries, and we take ozone from the machine. Here's a disruption also in the arteries. And just a second, I want to show you the wound here. It's a very bad foot, but it's been treated with ozone therapy, rectal insufflation, and bagging. So it's a really nice case. Usually they do an amputation for these patients, but with ozone therapy we can cure them. And we use the dosages of 60 to 100 micrograms for wound disinfection, and 10 to 40 micrograms for wound healing, for epithelialization of the wound. Here is another one. This is the therapeutic area that we use of the dosages of ozone therapy. And what about the mitochondria dysfunction in diabetes? The hyperglycemia and obesity causes mitochondrial dysfunction, and the pancreatic beta cell dysfunction, and then diabetes type 2 comes. So what happens in diabetes? In the pancreatic beta cells, there is a overproduction of superoxide radicals in the mitochondria, and this makes a dysfunction in the electron transport chain in the mitochondria, and there is a suppression of insulin because of this. And what happens? The superoxide radicals stops this stage of the glucose metabolism, and then the byproducts starts to rise, and then we have this aldol reductase pathway, and here we have this protein kinase pathway, and the byproducts increase with it. And with this mitochondrial dysfunction, superoxide radicals, hydrogen peroxide, and hydroxyl radicals increase in the cell. And this causes mitochondrial damage. Mitochondrial damage, DNA damage, nuclear DNA damage, and various cancers become to the patient, and diabetes type 2. And this overproduction of radical oxygen species and dysregulation of antioxidant system makes us ill. And with ozone, we can measure the increase of catalase as an antioxidant system. With streptozotocin, we make a diabetes model, and with ozone, you can see the increase of catalase as an antioxidant in an animal study. And here, you can see that with ozone therapy, we are increasing the antioxidant system so we can decrease the superoxide radicals. And this decrease of superoxide radicals makes this glucose metabolism work in the normal way, so that we can decrease the byproducts of ozone, of the glucose metabolism. And here is the fructolizin levels also. When we stop the superoxide radicals and the glucose metabolism starts to run in the normal way, so we can decrease also the fructolizin levels. Here is a diabetic animal model as a histological schema. You can see that in A, it's a normal pancreas. In B, there is a diabetic pancreas. And this one, we give oxygen. It's worse than diabetes. And this is the patient who has diabetes mellitus. We give ozone, and it's the regeneration of the beta cells and secretes normal insulin. So, here are diabetic foots of Olga Leon, you can see. And with ozone therapy, there is two groups with antibiotic group and ozone group. You can see that the plasma glucose level goes down statistically in ozone group, and in antibiotic group you cannot see the decrease of glucose level. And here you can see the endothelium biomarkers also in patients. This is a clinical study, antibiotic group, ozone group, and control group. After 20 treatments, you can see that in antibiotic group there is no difference in the endothelium biomarkers, but in ozone group there is significantly, statistically significant difference in the ozone group. So, this is also the superoxide dismutase antioxidant system increasing in ozone group after 20 treatments. You can see the green bar increasing. And here are some cases from our clinic. This is diabetic patients who had a bypass operation, and the nurse, by an accident, made this wound. And you can see the bone here of the patient. And after 2 months, we closed the wound. Here is another one. This is also a diabetic patient. After 2 months, it's also closed. And here, this is also a diabetic patient. They planned an amputation for this patient, and after 3 months we closed it. And here are some guidelines also for ozone therapy. And this is another patient. She had some keratinosis. This is the same patient in her foot actually, and this is her hand before treatment, after treatment, before treatment, and after treatment of ozone therapy.
Dr. Yeprem, you have 20 minutes left.
So we can regenerate our tissues, and we can increase our energy, and we can regenerate our mitochondria, and from cell to skin we can make an anti-aging program for our patients. Thank you for your listening.
Thank you, Dr. Yeprem, for your brilliant presentation.
Thank you.